43 stopping the vehicle Central and 40th Place. 13L30 is behind the unit.
Sit back and relax. Your group therapy session has started. Welcome to Alone and Unsupervised.
All right, guys, welcome to the Alone Unsupervised Podcast. As always, I'm Isaiah.
Right.
So we realized the last couple of sessions have been really law enforcement heavy. We want to take a break from law enforcement for a minute, if you will, and we figured we'd talk about some military things for a minute. I suggested barracks life. He suggested military schools. So
I think there's a little bit of both.
I was gonna say within military schools comes barracks life. So
True.
we're just gonna roll the dice, yell Yahtzee, and see what happens.
Well, I'm down.
Okay, so most of the schools I went to, well, all the schools I went to were um corpsmen or like medically related.
Mhm.
Oh, speaking of that, I saw a news article recently that it was on Facebook, so consider the source. But I don't know if you did this. I'm sure you did a version of it. It may be called something different, but do you know what I mean when I say live tissue?
Yeah.
Where they take the farm animals or pigs. Um, live tissue is where they take a pig, they put an IV in its ear, and they pump it full of ketamine to where it doesn't feel anything at all, and they teach you how to deal with different types of MOIs or mechanisms of injuries and how to save a human's life because anatomically on the inside, pigs and us are the same. So,
Similar.
Yeah,
Yeah.
more similar than anything else.
Yeah.
And they're not doing it anymore. Live tissue's no longer.
So here's the problem with live tissue. It obviously draws a lot of fire from certain activist groups.
Yeah,
And I get it.
one that kind of starts with the same title as the bread.
And again, I get it. I get the thought behind it. But ultimately, those and this may be unpopular to some, but those live tissue labs actually saved a lot of lives.
Yeah, it's not for no reason.
Mhm.
It's what I always compared it to is the gas chamber is not the gas chamber, it's a confidence chamber. It's letting you know that your gas mask will work. The same thing with live tissue. I did have confidence in my ability, but not a lot, right? Because there's only so much that you can do on a mannequin. There's only so much that you can do putting a tourniquet on your buddy that doesn't have his leg missing,
Mhm.
right? But whenever you do whether you're cracking a pig or you're putting a tourniquet on it or whatever, you're watching in real time.
Or chest
Hey,
tubes.
yeah, you're watching in real time. Hey, what I've learned and what I've been taught, when I apply it properly, it's actually going to work.
Yeah, and I mean, even beyond that, people will say, "Oh, there's all kinds of training aids out there." Well, cutting silicone
Mm-hmm.
is not the same as cutting tissue or
Mm-hmm.
cutting muscle.
Yeah.
And when it comes to some of those training aids, even the most realistic mannequins that there are out there,
Mm-hmm.
the ones that talk to you, the ones that respond,
Yeah.
it's still not the same
Mm-hmm.
as what
Live
you're feeling.
flesh.
Yeah, live flesh, what you're feeling. You're not feeling that heat. You're not feeling or seeing the actual physiological
The
changes
condensation
as they
on the
happen.
ET tube.
Yeah, and unfortunately, I think, and again, I'm not saying go out and
Massacre
yeah,
animals.
massacre animals just for the sake of doing that. No, I'm not saying that at all. I think a lot of people developed the skill that they did and were able to save lives with
Mm-hmm.
because of those live tissue labs.
Yeah.
Because there's just so much that those offer you in learning skills,
Mm-hmm.
being able to actually do the skill.
Mm-hmm.
It's yeah, I think that if that continues and the military, if they stick with that, they're not going to do them anymore.
Yeah.
I think we are going to run into a lot of problems when it comes to our medical
Bringing our troops home.
abilities. Yeah. I mean,
Hmm.
and again, I love animals too, but if the life of one pig can teach a handful of medics how to, do 5, 6, 7, half a dozen, whatever, dozen procedures,
Hmm.
I think it's worth it
Yeah.
because ultimately, these are our brothers and sisters out there who
Hmm.
are potentially deploying and, fighting and winning our nation's wars.
It kind of goes. I'm a big quote guy. It kind of goes to the quote that Bruce Lee had. I don't fear the guy that practiced 1,000 kicks one time. I fear the guy that practiced one kick 1,000 times.
Hmm.
It's that repetition of, and I only did live tissue once, and I'm not saying that we did these procedures on 1,000 pigs. No, we did a lot of procedures on one pig, and when I went through live tissue, if your pig lived at the end of the training, you passed. If your pig died, you failed. Like so,
And
and you had to redo the whole course.
with that being said, too, it's not like these animals are suffering in any way, shape, or form.
No.
They go to sleep
Mhm.
and they serve a greater
Mhm.
purpose of equipping, war fighters with the ability to save lives.
Yeah.
They say that military medicine, military medics, they're a combat multiplier.
Oh, for sure.
There's a reason for that.
Yeah.
And there's a reason why the stats went from what they were during World War One and World
Mhm.
War Two to what they've been during Iraq and Afghanistan.
Well, and it's also to be said, like for the enemy aspect, there's three things you're looking for: stars, bars, and crosses.
Hmm. No, it's true. Like, I mean, I hope that's not the case. I hope that somebody maybe has the good idea fairy swings back around and
Yeah.
taps him on the shoulder because
But uh, sorry, go ahead.
no, it's just because I think a lot of lives are going to be lost in the future
Mhm.
because people aren't equipped with those skills, or the only thing they've ever practiced on is a piece of silicone.
Yeah. Well, but think about it. Military practice is a lot of the military is dictated by societal changes,
Hmm.
and
But
that's just one of those things.
to take it even a step further, though, you're getting the pre-hospital care on the civilian side that you're getting right now
Hmm.
because of military medicine.
Well, think about ketamine.
Hmm.
That was tested in the military. Uh, I, I don't know the number of things, but there's a lot of medicine that is tested and evaluated by the troops before it even hits the civilian sector.
Hmm. I mean, look. I mean, I guess I'm going to date myself a little bit here, but going back.
Look at penicillin. No.
Wow. No, going back when I took my first EMT class,
Hmm.
if you even, I mean, tourniquets were always a last resort. You never put
Yeah,
on a tourniquet
yeah.
because if you put on a tourniquet, then oh my God,
That was still a thing while I was in the
yeah.
military.
But what's happened since then?
Yeah. Well, so I say that. So um the the first life I ever saved was with a tourniquet. It was I was right on the road. A dude wrecked on his motorcycle in front of me. He wrecked
Hmm.
so bad that he had a giant gash in his leg. I had my bag back in the car with me, ran up there, threw a tourniquet on. When the EMS got on the scene, they yelled at me for putting a tourniquet on. Well, I was like, okay, well, what's your operating procedure? They told me their standard procedure was if they bleed through three bandages, then we apply tourniquet. But
It's a lot of blood loss.
yeah, that's a lot of blood loss considering it's 60 to 90 seconds until you bleed out.
Yeah, I mean, that's blood you're not getting back in the body. I mean,
Exactly.
you are now because a lot of EMS agencies will carry blood products. And
Yeah.
why do they carry blood products?
Yeah.
Because
Yeah.
military medicine.
Well, one thing you're not carrying though, which I I get it. They're normally not sitting on a patient this long, but it blows my mind that on ambulances they're not carrying Hextant, which Hextant is a blood volumizer.
Well, but now, I mean, again, they're not doing that necessarily because they
Not
have
sitting on that long.
they have blood.
Yeah. True.
But there, I was able, and I shudder at the statement that I'm about to make because I never feel like I saved lives.
Mm-hmm.
But the lives I assisted in maintaining viable were only probably done so because of a lot of especially in like the real trauma
Mm-hmm.
scenarios. It was only because of experiences like the live tissue labs.
Mm-hmm. Mm-hmm.
I mean,
He's being humble. I've actually seen him save a life. I watched him snatch a life from the Grim Reaper.
lies. But I've done live tissue labs with goats, with pigs. And, I mean, there's been a few other animals, but
Could you imagine trying to do one on a cow?
no, I mean that one animal, that one
Mm-hmm.
pig, that one whatever.
Mm-hmm.
Again, that can train so many
Mm-hmm.
procedures.
And it wasn't a wasted life.
No.
It was a life that was for a purpose.
Mm-hmm.
More purpose than making bacon.
Yeah.
You know?
I mean, what bacon will sustain you for a few days, whatever.
Mm-hmm.
I mean, but ultimately,
The stuff I learned on that pig, I'll never forget.
no. And again, it advanced military medicine, which is in turn advanced civilian medicine.
Mm-hmm.
I mean, there are things that they are doing now, and think even beyond pre-hospital care. Think things that surgeons are doing now.
Oh yeah, for sure.
You know, trauma surgeons. Trauma surgeons are able to practice techniques
Mm-hmm.
now and do things because they became prevalent
Mm-hmm.
in combat zones.
Or think about the amount. Like I know a handful of corpsmen that I served with that are now trauma surgeons, or
Mhm.
Marines that are ER nurses. How many people? Maybe not all of them, but how many people do you know that you served with that are now in a professional medical field?
Mhm.
You know?
Well, and again, to kind of piggyback on that a little bit too, it's not just like military medics and corpsmen who
Mm-hmm.
are doing these live tissue labs. These are surgeons. These
Mm-hmm.
are ER doctors. These are the people who you're going to rely on
Yeah.
to save your life if
Yeah.
something traumatic happens to
Yeah.
you. And if you take that away, I mean, do you really want the first time that a doctor is patching a hole in your heart to
Mm-hmm.
be
The first time
their
he's ever
first
done.
time?
Yeah.
Yeah.
Exactly. You know, well, in it kind of goes into one of our previous sessions. It was a topic that we lightly touched on, but and again, not to take away anything from people dying, but the Boston bombing
Hmm.
or the Boston Marathon bombing. I think you said that the reason why there wasn't more lives lost is because the amount of first responders and veterans that were
Hmm.
attending or were there spectators or whatever.
Who put on tourniquets?
Yeah, yeah. But we kind of went down a rabbit hole.
No, I mean it's a viable thing. I mean,
Mm-hmm.
if it wasn't for this training, like I said, we would be in a worse place. I mean, what 2 decades of war in Iraq and
Mm-hmm.
Afghanistan probably advanced us in terms of trauma and
Yeah.
trauma medicine
One of the biggest things
further
that
decades.
one of the biggest things that we learned was the golden hour. No matter the severity of the injury, if you can get them to a higher echelon of care within that first hour, their chances of survival are vastly better. You know, and
And I'll push it a step further. I'm not saying you just shouldn't take this away from the military. You shouldn't take this away from medicine in general
no, absolutely not.
because not all of my live tissue labs have been in the military.
Mm-hmm.
And again, I am better
Mm-hmm.
at what I do because of them.
Oh, for sure. Yeah.
It's just, no, you shouldn't do that. I mean, again, I think this is a case of us maybe not learning from past realities, but
Mm-hmm.
instead trying to, maybe be kinder and gentler.
Yeah. Now, I will say where military medicine and civilian medicine differ is whenever I was still in the Navy, I took my national registry exam,
Hmm.
and there's things that you can do in the military that you can't do as a nationally registered EMT.
Hmm.
For me, I had a hard time turning that part of my brain off, and I failed my national registry because I was thinking as a corpsman, not a civilian EMT, and I failed the test because I picked the wrong answers.
Yeah. I understand why the military, for years and years, people would get out of the military and say, oh, well, I learned things, but I didn't learn anything that I can use on the civilian side. I have to go do this schooling and this schooling and this
Mm-hmm.
schooling to be able to do what I did in the military.
Yeah.
So, as I mean, I think it was more of a recruitment tool, but
Mm-hmm.
they opened up like certain certifications. Like if you become a military medic, I think all the branches now. I don't know for certain, but I think all the branches now, when you get done with your medic school, you take the national registry and you walk out as an EMTB.
Not in the Navy. Well, when I was the first class in Ford School that did not get the opportunity to take the national registry paid for by the Navy
Mhm.
because they had a lot of sailors that weren't taking it seriously, and they were just bombing it just because, oh, it doesn't matter. I don't need this, yada yada. So taking the ASVAB in high school,
Mhm.
how many people that took the ASVAB in high school actually took it seriously? You know what I mean?
Yeah.
It's kind of the same thing. So in my class in core school, the Navy quit paying for it. So
Um,
you had to go seek it on your own later on.
well, it was a part of the curriculum for us.
Mm-hmm.
So basically,
Now the Army and the Air Force still paid for it while I was in core school.
well, they paid for it because it was part of the curriculum.
Yeah, yeah,
So
yeah.
when you went to medic school, basically your first, I don't remember how many weeks, but your first X number of weeks was
Mm-hmm.
all in our EMT.
Yeah,
So
yeah.
you did all the classes,
Mm-hmm.
then you took the national registry.
And then you moved on.
From there, then you moved on to combat medic training.
Yeah,
And maybe that's what the Navy should do.
yeah.
So you don't have to worry about getting that
Yeah,
confused. But
we started out with the EMT stuff, and then I think we went to basic nursing, advanced nursing for the hospital setting,
Mhm.
and then we moved into corpsman history, and then we moved into field medicine.
Yeah. So, I mean, it's kind of similar, but
Mm-hmm.
there was a massive focus on National Registry.
Mm-hmm.
And there were people who got reclassified because they couldn't pass the National Registry.
Mm-hmm. Yeah,
So it was one of those things too.
yeah.
But it's like one of the I don't know if the Army still does it, but what they used to do is it didn't matter what you were. If you were a respiratory therapist, or if you were anything
In the medical field.
in the medical field where you were potentially treating patients,
Mm-hmm.
you always started with medic school.
Mm-hmm.
That was your base.
Yeah.
But I know for a while they got away from that and they
Mm-hmm.
just they didn't waste the time or
Mm-hmm.
anything. But I think that was an issue. I don't know if they ever switched it back or if
Mm-hmm.
they still do it that way. But again, I think we set ourselves up for failure there because I think anyone who's treating patients, aside from like the nurses, the providers, things like
Mm-hmm.
that, you need to have that base because you may be an optometry tech,
Mm-hmm.
but who's to say you don't have that person who has a cardiac event, cardiac arrest, whatever, in your treatment room.
Yeah, yeah. Exactly.
And if you haven't had some of those basic
Mm-hmm.
skills, or who's to say that the cache that you're assigned to doesn't get overloaded with
Cash.
a combat sport
Okay.
hospital, or that hospital you're assigned to doesn't have that MCI mass casualty event happen or
Mm-hmm.
something like that, and you have to step in.
Mm-hmm.
So
Yeah.
that's something that they should have uh, changed back if they haven't already.
Yeah.
I think this is another example of how we're kind of, I don't know, maybe devolving away
Mm-hmm.
from our preparedness
Yeah.
for
And
war.
medicine is not devolving; it is ever
Mm.
evolving. It's kind of like law enforcement. Once you think you have it all figured out and you think you know everything, time to get out of the field
Yeah.
because now you're dangerous and
Because,
not in a good way.
yeah, like I mean, right now we may be in a peacetime posture, but that can change in an instant.
Yeah, we're one catastrophically bad decision by a world leader away from going back to active war.
And the last thing you want, and the sad thing is, we do this cycle every single time.
Mm-hmm.
We get involved in some sort of a war or combat operation. We build up our military.
Mm-hmm.
We realize how some of our training or our shortcomings as training. We
Mm-hmm.
fix that. We get things good, and then again,
The good idea
wartime
of fairy
ends. Yeah,
rears his ugly head.
wartime ends. We want to save money,
Mm-hmm.
so we don't put as much into training, or
Yeah.
we don't put as much into what we should.
Yeah.
And then we're right back to square one.
Yeah.
And then the next conflict happens, and
Yeah.
it's
Yeah.
that vicious cycle.
Yeah. Well, speaking of downsizing or saving money or whatever, since I've gotten out of the military, I can't believe the decisions that the Marine Corps is making right now.
As far as
They've gotten rid of their assaultmen. They've gotten rid of snipers. They've gotten rid of tanks. Like, tanks. Talk about a battlefield multiplier.
Mhm.
You know what I mean? We're just going to get rid of our entire tanks. The Marine Corps no longer has tanks. They're done. Gone. Forever. See ya. Well, maybe not forever. But in the time we're in now, they got rid of tanks.
Yeah,
Marine Corps no longer has M1 A1 Abrams.
because we're getting back into
Mhm.
that peacetime posture, and it's going to come back and bite us in the ass at a
Which,
later time.
fun fact about the M1 A1 Abrams, since the United States has used that on the battlefield, we have not lost a tank in battle in tank to tank warfare. Yeah, which is kind of cool because think about World War II, how many tanks we lost?
Mhm.
A lot of them. You know what I mean?
Yeah, like I even watched. Shout out to Angry Cops. Not that you're watching, but I
He might
watched
be. I don't know.
a video he did recently where he
Mhm.
talked about this op-ed piece that a journalist did. Actually may not have been a
No, it don't
journalist.
matter.
Yeah, he was something, but he did this op-ed piece about how maybe the Marine Corps has outlived its usefulness and how it should be disbanded, that kind of thing.
Yeah, that guy needs to be taken up behind the woodshed and beaten.
But it also it goes to show that shift in mindset
Yeah.
that we're seeing.
Because I'm here to tell you, like the branch, hate the branch, whatever. Without the Marine Corps, I wholeheartedly believe this. We would be speaking a different language.
Is it like raw?
No,
Raw?
I mean literally, like another nation would take us over. Dude, I mean it. Like we need Marines.
Yeah, I'm not saying we don't, but I
I know you're
I
not.
think it
I'm just
goes.
saying that guy has a. It, everybody has an opinion, just like
Mhm.
everybody has a butthole. Some of them stink. You know what I mean?
It just goes to show the mindset
Mm-hmm.
set is shifting from preparedness
Mm-hmm.
for war to
Yeah.
getting that false thought of we're safe now.
Mm-hmm. Yeah.
Got some news for you. There's still quite a few terrorists out there. There's still quite a few foreign nations who would like to see harm come to us. And
Yeah.
the longer we play this game, the worse place we put ourselves in.
Yeah. Yeah.
So,
You know, one. Oh, sorry.
no, it goes back to we need to be training our warfighting skills. We need to be training our medical skills.
Yeah,
Because
because
those are the things that are going to make the most difference.
Joe Bob the terrorist, I guarantee you, he's training way harder than we are right now. Going back to schools though, one school that I wish I would have had the opportunity to go to was 18 Delta. For those of you that don't know, 18 Delta is the medical school that we send all of our special warfare fighters to that aren't in the medical field. It's a army school, and but every SF medical person has to go through it. And when you come out of that, not to insult anybody that's been to med school, but you're pretty much the equivalent of a doctor.
I mean, it's there's a lot of focus on medicine in like the most austere conditions.
Oh yeah, for sure. Like we're talking about sitting on a dude for 3 or 4 days and how you need to keep him alive.
Sometimes, yeah.
Yeah.
And that's the thing too. I think even our soft guys,
Mm-hmm.
I think we're going to start seeing those numbers get cut down and
Oh yeah,
dwindling more.
yeah. There was a recent episode of one of the bigger podcasts I was watching, and I can't remember the dates or the years or whatever, but it was within the last I think 15 years. This guy, he was a SEAL, and whenever he was getting out, they had brought one one SEAL in for that I think 6 month evolution. One
Hmm.
into that unit, dude. Like, and well, actually, not that unit. I'm talking NSW, Naval Special Warfare. They brought one dude in.
Yeah.
Like, talk about a horrible rate.
Yeah. We tend to not learn our lessons,
Mm-hmm.
and it just boggles my mind how.
But history does repeat itself.
Yeah. But that's why we should be learning from it too.
Yeah. Yeah.
No, it's funny. We actually started this whole thing with the idea of talking about military schools and
Mm-hmm.
barracks life in general, but
Again, unscripted. This
how
is what you get.
quickly we evolve into other
Yeah.
topics. But no, I mean, this is one of those topics that I think needed to be
Mm-hmm.
addressed, and I don't think we necessarily, even though we didn't plan it, even though we didn't probably even really think about
Mm-hmm.
addressing it, it's true.
Mm-hmm.
Um,
You want to push this one out a little longer than normal?
it doesn't matter. I mean,
Okay.
I go back to what I kind of said from the start. I am better and more medically proficient for having been given those experiences, such as live tissue labs.
Oh yeah.
And anyone from this point on who doesn't get to
Mm-hmm.
experience that is
Mm-hmm.
truly getting robbed
Yeah.
and will probably not be as effective as they could be.
Well, and talking about how like medicine evolves. Whenever I was in talking about chest seals, right?
Hmm.
I was taught leave a flutter valve. Then I was taught don't leave a flutter valve. You want a full seal. I think now we're back to you want a flutter valve, right?
Well, even like look at CPR.
Oh yeah,
Something
CAB, ACAB, or not
something as basic
ABC.
as CPR
Mm-hmm.
continues to change.
Mm-hmm.
Standards change like every few years,
Yeah. Yeah.
and they go back and forth.
Yeah.
Um, but
Now they now they say compressions is way more important than respirations.
mhm,
But it used to be respirations was more important, or they're equally important,
yeah,
or whatever.
but you know, those are some of those things that you can truly gather data. Evidence-based
Mm-hmm.
medicine, great thing.
Mm-hmm.
That's evidence you can gather at any hospital.
Well, one of the courses I had to go to is called Combat Trauma Management, and it's a 2 week course. And honestly, I could have skipped everything.
Mhm.
I could have skipped going to core school. I could have skipped field medicine. I could have skipped all of it, gone on that 2 week course, and probably come out just the same. Um, because it was a kick in the pants. It was the hardest 2 weeks of my life. And but that course was all of the data that they took from the Iraq and Afghan War.
Mhm.
It was TCCC, Tactical Combat Casualty Care, and they studied everything. And then the Navy took it and they compacted it into a 2 week course. And if you were a foreman that was attached to a Victor unit or an infantry unit for the Marine Corps, That was a pre-deployment requirement. You had to go to that course
Mhm.
if you were to deploy. If you didn't, sorry.
No, it's the same thing for the Army.
Mm-hmm.
They have what they call PDT, or what they used to call PDT, which is pre-deployment training.
Mm-hmm.
And
Yeah.
you would go down to Fort Sam Houston,
Mm-hmm.
and you would basically do TCCC.
Yeah.
But TCCC brings up another good point. If we didn't have TCCC and the
Mm-hmm.
lessons we learned in combat about TCCC, then on the civilian side, we wouldn't
Mm-hmm.
have tech.
Mm-hmm.
And I mean, think about all the things that we address with tech
Mm-hmm.
that come from TC3, uh, such as dealing with active assailants
Mm-hmm.
in schools and in
Yeah.
different businesses, as within law enforcement or EMS
Mm-hmm.
or fire. Your response, what you do, is ultimately the child or
Yeah.
grandchild of
Yeah.
TC3.
Well, it's just like learning Stop the Bleed in the academy.
Mhm.
Take cops from the 90s. Do you think they learned Stop the Bleed in the academy? Do you think they had med kits in their cars? No, they didn't.
No, and
Now maybe that salty Vietnam vet, I'm sure he had something. You know what I mean? Most of the veterans that I know, or that they have more gear than your normal cop or what your agency loadout is. But that that just comes with experience. But because of TC3, we're more educated, and that's why we're able to go into these medical calls and we're able to assist EMS. We're able to be extra hands-on, or hey, I need you to do this or do that, or hey, it's doesn't matter if like what it is, but we're a force multiplier for them.
yeah, exactly. If you don't
Hmm.
get exposure to those skills,
Hmm. Well, I mean, think that one call we were on, that was like a 2 or 3 hour call.
mhm,
That one medical, and I know you know what I'm talking about. Me, you, and the 3 or 4 people that showed up, all of us were working to actively save that person's life.
mhm,
And it worked. She lived.
yeah. If you weren't doing something,
Yeah.
then you were doing something else.
Yeah.
If you weren't doing
Yeah.
CPR, then you
Yeah.
were.
And all of us were working. All our hands were everywhere
Mhm.
doing something. Yeah.
And again, my confidence wouldn't be what it is without those experiences.
Oh, for sure. Yeah.
So, I mean, my ultimate message to people I guess would be, don't screw with military medicine.
Mm-hmm.
Let it do what it does, because whether you're in the military or not,
Mm-hmm.
it is going to make your life better or end up saving your life somehow.
My grandfather was an old farmer, and he had a saying that perfectly fit this: if it ain't broke, don't fix it.
I agree.
Yeah. So we wanted to talk about barracks life and military training or military schools. Well, you got two salty medic guys that
Mhm.
sat here and did what two salty guys would do. Back in my day,
So we still got later sessions. Hey,
yeah,
don't forget to like,
follow,
subscribe,
yeah,
share, all that fun stuff.
do the things,
Hit the bell.
yeah,
Hit the bell.
hit the bell.
I think we
Yeah,
have a bell. We should have a bell.
we have a bell.
We have a bell. Hit
Do
hit that.
do the things. Don't be a negative community member. All right.
And don't be a troll. It's not going to end well for you.
Or you will be on our next Keyboard Kiddos segment. So, do what you want to. It's your life. Follow your fart. It's one of those again, huh?
Yeah.
Don't read it. Don't pre-read it.
Don't let the news say local man or woman with your photo attached.
Facts.
Excellent advice.
Lay by.
Love you. Bye.